Good morning. My name is Ron Greenwald with the Greenwald Gerke Realty team here in San Diego County, California. And as you can see, my business partner is not here today. Patty Gerke is doing a well-deserved vacation with her hubby, and I'm hoping they're having a great time. They are discovering relatives in Argentina. Isn't that a fantastic idea?
It is.
So I hope they're just doing super well. And we have a great show for you today, and you can see by the title, What is Hospice? A very misunderstood business model, and we have an incredible guest that we will introduce in a minute. But first, we want to talk a little bit about our field of life that we talk about when we are meeting with our senior clients as to what we do know, that life is going to throw you a curveball. And we have this field of life that we hope that you will look at and then help you encompass all the people, the right people, that you should have in your life so that your quality of life is the best it can be. So actually the question for the day is, besides what is hospice, Patty and I realized we do not have hospice on the field of life. So we are thinking of, you know what, if you want to email us or contact us as to where you would place the hospice business model on this field of life, we would love to hear from you. I'm not going to even give you my opinion. I want to hear from our clients. So for that said, I want to introduce our guest. Our guest is Natasha Vakili.
Yes,
Did I say that right? Thank you. She is the Chief Financial Officer for Apreva Hospice here in San Diego. And I know I don't like to read, but I'm going to read a little bit, so bear with me. She found her passion for hospice early in her life. We talked a little bit about that. When you were a teenager,
Yes.
she dealt with hospice and her grandparents. So she really saw the value of hospice very early, very young in your life. And she really strives to make sure all the clients for Apreva have the best experience possible. She received a certified hospice, she's a certified hospice administrator, a business administration degree, and a BA in psychology.
Yes.
So you really have it all covered. That's very impressive.
Well, thank you.
Awesome. So she joined Apreva Hospice in early 2011 and has since been dedicated to providing the highest service to the patients. So before we get started, can we take a shot of these? Can we do that, Paul? Are these amazing? Look at that. That to me is worth. I love
thank
those
you.
shoes. Thank you.
Thank you,
Thank
sir.
you. So anyway, so tell us a little bit about your experience with hospice with your grandparents, and so that helps explain what is hospice.
Of course. So, like many other individuals, hospice was something that my family and I were unfamiliar with, and it was recommended to us when my grandfather was battling cancer and when there were no further treatments available to him. And in the final days, we decided to take that palliative approach, not knowing the term palliative at the time.
And
But
why don't you explain palliative, because that's a
It's-
misunderstood.
Yes, it is. And so palliative care is when you are addressing symptoms that the patient may be experiencing, and the goal is comfort in that situation. We're no longer seeking aggressive curative treatment options, but accepting the patient's condition for what it is and doing what we can to provide comfort and relief of the symptoms that they're experiencing: pain, agitation, anxiety, shortness of breath, etc. So hospice takes that palliative care approach to it. Not all of palliative care is hospice, but hospice is always palliative care. And so there are some palliative care organizations out there that are able to provide that comfort-based care concurrently with some aggressive treatment options, or it might be what would be seen as an aggressive treatment option, but it's really with the intent of bringing comfort temporarily. It might be reducing the size of a tumor, knowing that we can't cure it, but if we can shrink it a little bit, it might bring some comfort to the patients. And so
with your grandfathers, I mean, we can use him. Who introduced you, or who told you about hospice? Because that's always the big, is it the hospital administrator, or is it how do we find you?
with my grandfather, it was something we had heard from both his oncologist as well as the hospital staff. They'd brought it up in the months leading up to his passing, but my grandfather wasn't ready to give up. And so as family, we decided to support him in his fight to the best of best of our ability. And when he came to terms that there was nothing else that he could do at that point, then we reached out to his doctor, and they were able to initiate the order to a hospice. And hospice came out, and unfortunately in his case we were on for a very short duration of time.
Were you able to get him home? Or?
He was home at the time.
Oh.
He was home at the time. The hospital had kind of said, there's no point in bringing him back here. There's nothing we can continue to do for him. So at that point, his wish was to pass at home. And so we called the doctor's office. The doctor's office got in touch with hospice. They sent their team members directly to the home. They began their care for him. And he was able to get all of his symptoms under control. He passed peacefully at home, which was his wish, surrounded by his wife, his children, and his grandchildren. And so they were able to take a very difficult time and make it something that was not only comfortable and peaceful for the patient, but also for the family that was there. And so
I can tell it's emotional to talk about that. That's
it can be. You know, you never want to see your loved one suffer. And you're never ready to say goodbye.
Never.
And I think that's the truth.
That is
whether
never ready. No matter how you think this is a relief to the person who passed, you're just never.
Yeah, we love them. We want them around longer, and you know.
No matter if they're 99, 102,
exactly.
whatever, doesn't matter.
And, you know, 2 of my 4 grandparents lived to be 92 and 93, and
that's fantastic.
it makes it that much harder because that's that much longer you've had them around, and so you get used
and
to
you
them.
get their wisdom.
Yes.
With age does come wisdom. I'm trying to tell my children.
Yeah.
So tell us about Apreva Hospice.
And so Apreva Hospice is a hospice here in San Diego County. There are hospices throughout the nation. It is a program that is funded by almost every insurance plan with 0 out-of-pocket cost to the patients and their families. And so Apreva Hospice is locally based here in San Diego. All we do is hospice. There are other organizations out there that have different lines of business. They may be doing home health, hospice, skilled nursing homes, home care, etc. And what we've done is just made ourselves the hospice experts. We've left the other lines of business to other providers out there, and it started from the owner's personal experience with hospice as well. And so I think what really sets us apart is from top down, we've been on the receiving end of hospice. And so having been that family member that's seen their loved one go through it, been the one calling into hospice when there's been a change in condition and we've needed guidance, assistance, support from the hospice, we set our model up differently. We're a very nurse-driven organization from top down. Our executive director is a registered nurse. Our director of patient care services, that's typically held by a registered nurse, is actually a nurse practitioner.
Oh, that's nice.
So our team has a lot of clinical senior leadership as well as mid-level management. And we've put the patients first. It's someone's, for me, every patient we bring on is someone's grandmother or grandfather. For the owner, Noel, it's mother or father. And so
that's great.
there's a personal touch. And, you know, hospices, we're all supposed to do the same thing.
So,
Medicare
right.
sets those guidelines for us.
So if I am concerned about the longevity of my loved one, maybe I'm not quite, maybe that my mother or father is not quite ready for hospice, but I want to know more about it, what would be the next steps?
What I would say is call a hospice, call Apreva. Look us up online. It's aprevahospice.com. Our phone number is 619-450-4414. And call us, and we'll come out and we'll do an informational visit with you before you need hospice.
Okay.
I think the most important thing as an individual is to know what is available to you and make informed decisions. You know, we talked about my grandfather that we used hospice for. He had a cancer diagnosis. That's what we thought made him hospice appropriate. My grandmother, 2 years later, ended up going on to hospice. It was after she was hospitalized and in the ICU that the hospital doctor recommended hospice to us. Her other physicians hadn't mentioned it prior, and she didn't have a cancer diagnosis, so we didn't know she was eligible for the benefits. And so there are other diagnoses beside cancer that can make a patient eligible for hospice. And I wish we would have known that back then, because what my grandmother suffered through in her final months could have been relieved by hospice.
Oh.
And I think she would have benefited from it. My grandfather was on for a very short period of time. My grandmother would have been on a lot longer. Her disease prognosis was different than his, and I think, if anything, without having hospice there, we probably shortened her lifespan, because we'd have to call for a medical transport to come and pick her up, to take her to a doctor's office, when they weren't even doing anything, just basic medication management, checking her vitals, etc., that hospice could have come into the home to do. Hospice could have been there as her decline progressed to treat it proactively, to ensure a smoother transition in her final journey, instead of us being reactive after things had happened. And so it's one of the true values of hospice, is that we're there to walk that journey with you. Every journey is different.
So obviously people are in a very difficult state. So just set up the expectations of what hospice is there, or what do they
and
do?
what it includes. So hospice care is led by the physician, your primary care physician, your attending physician that you've had continues or can continue to be a part of your care. The family's still involved. You don't lose any decision-making options in there, in that process. And then with the hospice team, you have access to all of the hospice physicians and nurse practitioners that we have. You get registered nurses, you get licensed vocational nurses, you get home health aides that help, certified home health aides. They help with the personal care and come out and assist the patients with bathing and more of that care. There's the social workers and the spiritual counselors and chaplains. Sometimes some of those resources, like the social workers, are of more value to the family. Sometimes the patient may have dementia or Alzheimer's, so the social worker is really more of an asset to the family at that point. And then we also have volunteers. We use companionship volunteers, individuals that go and sit bedside. Got music therapy, aromatherapy.
The music therapy is huge.
It is. It's, if you've ever witnessed music therapy and what music can do for a patient, someone who might be nonverbal, someone who may even be unresponsive at that time, it can be really magical to see the impact it has for the patients.
So if somebody gets a diagnosis and they're not quite, I mean, when is there is no right time, or am I?
Medicare being the primary payer for hospice, and the CMS Medicare guidelines are what hospices operate under. And so in order to be eligible for hospice, Medicare would say that you have a prognosis of 6 months or less if the disease were to follow its natural course without any further treatments. Now, as we all know, no one has a magic 8 ball. No one knows how much time any one person has and what that progression will look like. And so that's just the guideline that we go off of. And there's certain things you can look for: frequent hospitalizations and ER visits. If you're having weight loss that's unintentional, you're having more infections, more falls, more, eating less, sleeping more, the patient's sleeping more, they're less active, they're more bedbound. There's a lot of different signs and symptoms that an individual may indicate that they're getting closer to their final transition. And it's different for every person. And so the best thing to do would be to talk about it with your physician. You can contact hospice. Hospice will come out and evaluate a patient, and there's no cost to the family for doing that. And there are times we'll go out, we'll do an informational visit, we'll gather baseline information as to what the patient's current status is, and then we can keep in touch with you as well
Just
and
to make
follow up.
Right.
And then as that disease is progressing and we're following up and asking those questions, we can help say, well, maybe it's time to get them on.
And do you do all the paper? Do you, Apreva, do the paperwork, or who's doing the?
It's all taken care of by Apreva and your physician.
Okay.
We just need an order from a doctor. If you're haven't been seen by a physician, you don't have doctor you're going to, you can contact us and we can
Handle.
obtain that order from one of our hospice physicians as well.
But just to be clear, you're not there 24. I mean, so if somebody has home care, you're working.
Right. So the way hospice works is that there are scheduled visits that we go out and do for the patients, and the frequency of those visits depends on what the patient's needs are at any given point. And so if you come on earlier, you're more stable, you may only be seen by a nurse once every week. But if as you progress, you decline more, then we can increase the frequency of those visits so that the nurse would come out and visit you more often. The home health aide would be there more often to assist with personal care. And then while we're not there 24/7, we are available 24/7. And so one thing that sets Apreva apart from other hospices in town is that we have a dedicated after-hours team. And so 24 hours a day, 7 days a week, 365 days a year.
You never know.
You never know.
When, it's gonna,
when you call, you're always speaking with one of our nurses. And that nurse, if you're calling after hours, that's all she does. She's not your same nurse from daytime that's now up working at night to take care of it. And so we've got operations are no different at 3 in the morning than it would be at 3 in the afternoon. And if you call and you have a need, whereas in the past, patients without hospice would have to call 911 and perhaps go to the hospital. Now, this nursing support and team comes to you, and we'll go and make a visit at the patient, their place of residence. We can provide care wherever they are, in a home, in a nursing home, in an assisted living facility, and bring that care to them so that they don't have to
I think
go through that.
It's a very, again, nobody, what is hospice in terms of talking about it? I can't tell you enough. And the way I feel about it, if we would have done it earlier with my father, I think it would have been, his end of life, those last few days would have just been a much better experience. So don't wait till it's too late. And by the time, nobody wants to really die in the hospital bed. And most people, if I'm saying it right, through my experiences and my knowledge, they wait too late.
They do.
And then they end up passing away in the hospital, and that's not what the family is looking to do, or that person's wishes are to die at home around the family in a peaceful, relaxed state of mind. And that's what hospice...
It is. I've never heard a hospice patient say, I think we went on to hospice too soon.
Yeah.
You hear the opposite. I wish we would have used hospice sooner. And that's
just get to know what you guys offer.
And with advancements in medicine, the clinical teams, the nurses, they can get the patient's symptoms under control relatively quickly. The majority of symptoms that a patient can be experiencing at end of life, the nurses can get under control quickly. But the psychosocial support that comes with hospice, the spiritual support for those that have a spiritual background in faith, and the social workers, the preparations, as you look at your field of life, you've got a lot of different entities on there. You've got your estate planning attorneys, you've got your professional fiduciaries, you've got so many different pieces that, as you know, so many individuals don't utilize, they don't plan for end of life. They don't have advanced care planning for that time. And so the social workers are able to assist with that. When the patients come onto hospice, our social workers assist with mortuary arrangements and planning. And it's by no means to be morbid about it, but so that when that time gets closer, the family doesn't have to be worried about that, but can rather be present with their loved one. And so the value that hospice brings is not just to the patient, but to the family. For yourself and I that have used it, that we can look back and see the comfort that our loved one had, but also how they helped prepare us as much as it's possible. Right. You're never ready to say goodbye.
We're never ready to say goodbye, and again, it's 100%. I know it's a flippant, 100% death rate in the state of California, as far as I know, and I know it's you have to make some light of it, just because it is a very difficult subject. But it's like anything else. If you call and get information and meet with the people from Apreva, you won't have that hesitation when the time is right. You'll know what to expect, what's going to happen. And really, all that's for the benefit of the loved one for sure that's going to pass, but also for all the family dynamics. We see way too often where everybody's making a decision in crisis mode, as opposed to, no, we've interviewed Apreva 6 months ago when we first got the diagnosis. We know who they are. We're comfortable with them. We're comfortable with what they're going to provide for my loved one, and we can move on.
And the nice thing with hospice, too, is even when the patient does pass, hospice doesn't go away.
Right. That's another
So
great point.
Apreva's still there for a minimum of 13 months after the patient passes. We continue to provide bereavement and supportive services to the patient's family members that we worked with. And so it's part of the journey. And what happens
It is a journey.
after your loved one passes is part of that journey too. Unfortunately, it doesn't just stop and end there. And so we try to connect with our families. Our caseloads are lower than anyone else in the county. Our nurses see their caseloads are about 11 to 12 patients. I know other agencies, other hospices in town have 25 to 35.
Wow.
And so for Apreva, our goal is to allow the team members that we send into the patients' homes to have the ability to spend the time with the
quality
patient,
time.
to answer all of your questions that you may have. And we start that before you come on to hospice.
Right. Did we miss anything? Because our time is running a little short. I mean, did we cover what you? I mean, what?
I believe so. You know,
Because I mean, it's such an important topic, and we really want to get the word out there
Yeah.
so that we can get it on the field of life, and we can. Again, I'm going to close by saying Patty Gerke and I, we just are involved with too many people that are living in a crisis situation, and they don't know who to turn to. They don't know the next steps, and then there's family dynamics that fall apart, and then there's all kinds of squabbling, and it's a sad situation, and nobody wants to know. You know, when they're passing, they want to know that there's going to be peace.
Yeah, and the reality of it, as we've talked about, is you don't know.
You don't
And
know. You don't know.
there are times that patients come on to hospice and they graduate off of hospice.
Yeah, it's not a.
They improve. Sometimes having that support, having someone that's monitoring their condition, their medications on as frequent of a basis as we are, helps to stabilize that patient. And then there are times that we do discharge them for extended prognosis. We call it graduating off of hospice.
If you graduate off hospice, you're a winner.
And it's a great thing. And you know what? Though surprisingly, those families are upset because they don't want, the families and patients don't want to lose the support. And so we keep in touch with all those patients, and when they need us, we'll be
back.
there again. But it's just important to know what's available.
Right.
You know, I wish we would have known more about hospice because we would have utilized it sooner. And it's just about making informed decisions. And so call us, meet with us, get the information you need, and know that you're part of it.
AprevaHospice.com. AprevaHospice.com.
Yeah.
Learn about it, call them, get information. It may not be today, it may not be maybe 3 years from now.
I hope it's 10 or 15 years from now.
But you know something's going to happen. When you're 90 years old, the odds are something's going to happen, right? So do your homework now. Understand the field of life and all these people that can support your loved ones and the family while you're going to go through this journey, and get to understand what hospice is all about.
I'm going to close with one piece.
Okay.
Coming on to hospice does not expedite your transition to death.
Oh, great.
That's a misconception, too, that if I go to hospice, then I'm giving up and dying and that they're going to expedite my death. They do not. The death is happening whether hospice is there or not. Let us walk that journey with you. Let us hold your hand so that you don't have to do it alone.
Great way to end it. This is Ron Greenwald with Senior Stay or Go TV, part of the Greenwald Gerke Realty team. We thank you for watching this. Natasha, you've been a great guest.
Thank you, Ron.
Please come
Appreciate
back
it.
to us. And have a great day out there. Have a great year. And we enjoyed having you. Thank you.